Hello and welcome to our suicide prevention presentation. My name is Elise Greenaway and I'm a licensed clinical social worker employed by Pleasanton Unified School District. And this is a training that we did at all of our school sites here in the district. And we wanted to record it and make it available so that anyone can benefit from this information in case they weren't present for the presentation at their site, or if they're just wanting to get this information for themselves. I want to start off by giving a disclaimer that we do recognize that suicide is a really sensitive subject. It may be something that you've dealt with in your personal life with a family member, maybe something you've struggled with, or maybe you've had a student in the past that you've had to take these steps to do a suicide assessment for. And so we just want to encourage you to go through this at your own pace. If you need to stop and come back to it at some point, you're welcome to do that. We're going to start the presentation by just going through some statistics on suicide. So suicide is unfortunately the third leading cause of death for young people ages 10 to 24. So in that window, we have, that's starting in elementary school with fifth graders are usually 10 years old. And so this is something that we're seeing at all levels of our district, elementary, middle, and high school. Sadly, for every one completed suicide, there are 25 attempts. So we hear about completed suicides, but we only hear about the ones that are actually carried through. We don't even hear about a lot of the attempts. Sometimes, unfortunately, if it happens on the weekend, parents don't always necessarily think to reach out to us, or maybe for privacy purposes, they don't feel comfortable doing that. So just to be aware that we have certain statistics for suicide rates, but there's also a lot going on behind the scenes that we might not see. 4 out of 5 students who attempt suicide have given clear warning signs. Although this is a very daunting statistic, it's actually hopeful because it means that there are things that we can do to try to prevent suicide. And that's what this whole presentation is about. It's what can we do as school staff to keep an eye out and know the warning signs for students. And then lastly, the rate of suicide attempts is 4 times greater for LGBT youth and 2 times greater for questioning youth than that of straight youth. So just in the direction our culture is going today, we talk a lot about in our schools, how do we make LGBTQ youth feel comfortable, feel at home? And so this is just another thing to be aware of. The reason that we created this presentation and have been doing it at all 15 of our school sites here in the district is that an assembly bill was passed this last year. And I'm not going to spend time going through the entire assembly bill, but I do want to highlight a couple things. One is that it talks about how school personnel are the people that are interacting with our students on a daily basis. And so that is putting them in a prime position to recognize the warning signs of suicide and make those appropriate referrals for help. We also know that, results from surveys show that teachers and school staff are the number one person that a pupil would, reach out to if they're feeling suicidal or if they have a friend that is feeling suicidal and has confided in them. So today is all about equipping you guys and making sure that you feel confident to handle a situation like this. Before we go any further, I just want to cover some common myths surrounding suicide. The first one is that talking about suicide will plant the idea. What we know is that it actually decreases the risk of suicide because it decreases anxiety and maybe some of the secrecy around what students might be experiencing when they have these suicidal thoughts. Someone who talks about suicide is just trying to get attention. So although we do have some students that unfortunately use talking about suicide as a way to get attention, that's not always the case, and we need to be following the mindset of better safe than sorry. So although it doesn't apply to every student, we do need to make sure that if a student is sharing suicidal thoughts, that we do take those seriously. And then lastly, if someone wants to commit suicide, there's nothing you can do to stop them. Luckily, this is not true. There are a lot of ways that we can intervene as adults, and oftentimes time is our best friend in these situations. If we can get students to slow down and really think through their decisions, this is going to really benefit them and help them have a big picture perspective. So there's no one specific cause for suicide, but some contributing factors that I want to go over are health factors, environmental, and then historical factors. So when we talk about health factors, mental health disorders are a big thing. 90% of students that attempt suicide have a treatable mental health disorder, which again is a daunting statistic, but it's good news because it means that there's actually something that we can do about it. We can connect students to mental health treatment, and that's why we have counselors at our school sites. That's why we have social workers employed in the school district, is because we want to work with families and help them to get connected to those mental health resources that they need. We also know that substance use disorders are a big deal. And when a student is under the influence, it can really impact their ability to rationally think through a situation. Things like serious or chronic health condition or pain, traumatic brain injury, these can also lead a student to feel hopeless if they're struggling with something day in and day out. Smoking, and then antidepressants. So I just want to preface here, when we're talking about antidepressants, we're not promoting or telling people they should not be using antidepressants. We have a lot of students in our district that are utilizing antidepressants, and for them it's been really life-changing and has enabled them to be engaged in school in ways that maybe they couldn't have before. But the reason that I bring this up is because one of the things that a doctor will tell you when they are prescribing an antidepressant is that sometimes if the medication is not a good fit for you, it might have a side effect of suicidal thoughts. And so in that case, you want to call the doctor immediately. As far as environmental factors, the concept of access to lethal means, this is a big thing at home. If there's weapons that are, loaded and not locked up, if there's medications in medicine cabinets and no one's keeping track of the pill count, prolonged stress, individual stressful life events, exposure to another person's suicide is a big thing. So when a student does commit suicide, we have to be really careful in how we memorialize the student. We want to be respectful and sensitive to their death, but we also don't want to, give off that they're a hero and that might cause other students to copy that behavior in hopes that they would have a heroic memory as well. As we talked about before, gender confusion, so our LGBTQ youth might be struggling with this more. And then hopelessness. So if a student is just experiencing tunnel vision and they just really can't seem to think about the next step or what's next to come in life, that can really play into that. And then historical factors. So if they've had previous suicide attempts, we need to be more aware. A family history of suicide or past abuse can also be factors that contribute to suicidal thoughts. I want to clarify that when we talk about family history of suicide and past abuse, we're not saying that if either of these things have happened, that a student is definitely going to be suicidal. We're just saying that it does increase the risk and it's something to keep in mind. So as far as red flags, I just want to encourage you that your job is just to keep an eye out for the red flags. You're not responsible for counseling students. That's why we have school counselors. That's why we have social workers. And your job is just to know what the red flags are and be looking out for them. So when it comes to talk, when a student's talking about feeling hopeless, threatening suicide verbally, like we talked about, sharing that they feel like they have no reason to live, they feel like a burden to others, they feel trapped or experiencing unbearable pain, these are things that we really want to take seriously. When it comes to behavior, we want to take a look at reckless behavior if that's increasing. So a lot of times this reckless behavior can include substance use. If they're stopping or starting taking medication abruptly, they're searching online for materials or means. This is something that if you are a teacher that has computers in your classroom, you really want to monitor what is being searched for. And if you see that students are searching for what drug combinations could kill me, or where can I buy a gun without an ID, those are things to take note of. Withdrawing from activities, isolating from family and friends, sleeping or eating too little or too much, just anything that's not the norm for the student. And then the typical things like visiting or calling people to say goodbye, giving away prized possessions, aggression, artistic or writing expressions of death. This is something that we see a lot in the classroom, is that a teacher might give an assignment and then the student shares information or has maybe like a darker affect in their artwork or their writing that we need to pay attention to. And then neglecting personal responsibilities such as pets or schoolwork. As far as mood, this can be really challenging because when we're working with adolescents, teenagers, there's already a lot of mood swings, but what we're looking for is just when a student is acting different than their norm. So depression, extreme mood swings, anxiety, loss of interest, irritability. This is common for our younger students when we're talking more about the elementary age. The irritability, humiliation, and agitation are going to present themselves more as far as suicidal moods than the typical like depression or anxiety. And then if a student's, has a lot of rage or seeking revenge, and then we also want to be really aware of extreme distress followed by a sense of peace. The good thing is that there are a lot of protective factors for students that may be struggling with suicide. And a lot of these protective factors can take place in the school setting, which is another reason that we want you guys to have this education. So as we talked about earlier, mental health care is a big part of why we have counselors and social workers in our district. We want to connect students to mental health care that's appropriate for them that can meet their needs. Family engagement. As a school district, we're always trying to educate family on what they can look out for as far as mental health for their students and how can we make them more part of their students' wellness. Peer support, connectedness to school and community. We have PBIS, Positive Behavioral Interventions and Supports, and this is all about helping kids feel like they belong at school, like they're connected, that they're part of something bigger. Problem-solving skills. So if a student can learn how to work through a difficult math problem in the classroom, they can use those same skills and apply those outside of school when they're struggling with something at home. Things like helping the student increase their self-esteem, helping them explore cultural and religious beliefs. We know that if students feel like there's something bigger out there, if they have some kind of deeper purpose, that's going to decrease their risk of suicide. Self-care, which is something that as adults in their lives we can model. Restricted access to lethal means, so making sure that our classrooms are a safe place, making sure that we're talking to parents about locking up medications, locking up weapons, things like that, and then helping students explore purpose in life.